How do liquid biopsies work for breast cancer diagnosis? Imagine a simple blood test that can tell us a lot about breast cancer without needing to cut into tissue. That's what liquid biopsies aim to do. They work by analyzing tiny pieces of tumor-related material that cancer cells releases into the blood or other body fluids. These materials include circulating tumor cells, which are actual cancer cells floating in the bloodstream. They also look for circulating tumor DNA, which are small fragments of genetic material shed by cancer cells. Additionally, they analyze cell-free DNA, tumor RNA, extracellular vesicles, and even tumor-educated platelets that have been influenced by cancer. To perform a liquid biopsy, a healthcare professional draws a blood sample, usually about 5 to 10 milliliters. This sample is then processed using advanced molecular techniques. These techniques can identify and measure the tumor-derived genetic material present in the blood. Because these materials come directly from cancer cells, their presence can indicate that breast cancer exists, and they can also reveal specific genetic mutations or molecular features of the tumor. This information helps doctors understand the biology of the cancer better. One of the biggest advantages of liquid biopsies is that they are minimally invasive. Unlike traditional tissue biopsies, which requiring a needle or surgery to remove a piece of the tumor, blood tests are easier and less risky. They also allow for real-time monitoring of the cancer's behavior. For example, if a patient is undergoing treatment, repeated liquid biopsies can show how the tumor is responding or if it is developing resistance. They can also help detect minimal residual disease, which is tiny amounts of cancer remaining after treatment, or early signs of relapse before symptoms appear. In breast cancer diagnosis, liquid biopsies are especially helpful when imaging results are unclear or when tissue biopsies are difficult due to dense breast tissue or other health issues. Some tests have shown high accuracy in distinguishing early breast cancer from benign conditions, including ductal carcinoma in situ. However, there are still challenges. Detecting tumor DNA in early-stage breast cancer can be difficult because the amount of circulating tumor material may be very low. This means sensitivity can sometimes be limited, especially in early disease. Currently, no liquid biopsy test is officially approved by the Food and Drug Administration for routine screening of breast cancer. Most are used in research or to monitor advanced or metastatic disease. Scientists are actively working to validate these tests for early detection and routine use. It's important to remember that liquid biopsies are not meant to replace tissue biopsies. Instead, they serve as a complementary tool, providing additional molecular information that can help guide personalized treatment plans. In summary, liquid biopsies detect tumor cells and genetic material circulating in the blood, offering a less invasive way to understand and track breast cancer. They hold promise for earlier detection, better treatment monitoring, and more personalized care. Still, more research and technological improvements are needed before they become a standard part of early breast cancer diagnosis. Always consult with healthcare professionals for personalized advice and treatment options.